Hi, welcome to Upper Cervical Chiropractic of Georgia. I know that you're here for any number of reasons. Maybe you're here for some pain, or maybe you have an illness, or maybe you're here just to make sure that your body's functioning and healing the way you're supposed to, so that you don't develop into these problems in the future. Upper Cervical Care is a unique philosophy, science, and art that focuses on obtaining and maintaining proper communication between the brain and the rest of your body. Upper cervical doctors focus on the top two bones in the neck. And the reason we focus here is because in between those bones is your brain stem. And your brain stem is literally the Houston control of your body. Every single organ, cell, and tissue is connected through a nerve to the brain stem. So when a bone is out of alignment in the upper part of your neck, two things may occur. The first thing that may occur is that it pinches and crushes the brain stem. Now, if we pinch a nerve to an organ, literally every single organ, cell, and tissue is connected to your brainstem. It's kind of like a switchboard operator. So if that organ is getting good nerve supply and good communication, then the organ is going to heal or function. If that area is crushed and pinched, over time that nerve will begin to malfunction, it will become dysfunctional, and at certain times begin to malfunction and shut down. Now the other thing that happens is this, is that your head literally sits on top of the first bone in your neck. So wherever that bone goes, your head will follow. So if the bone locks out of alignment and your head goes on a tilt like this, your brain will begin to not work right. You can't afford to have this, so your brain has its own reflex that'll kick in, and it will literally tell your body to turn, twist, and rotate until that head becomes level. So over time, you might develop an abnormal posture that you're sitting in. And when you have this abnormal posture day in and day out, you begin to wear your body out, and over time you're going to develop into things like neck pain, upper back pain, lower back pain, hip pains, sometimes even knee pains, ankle pains as such. So our focus in this office is to make sure that your top two bones are in proper alignment. So not only are you functioning and healing properly, but at the same time, your body's in balance and you can live many, many years without problems. Therefore, if you have a bone out of alignment in the top part of your neck and is putting pressure on your brainstem, then Upper Cervical Care is for you. From here, what I'd like to do is explain to you what you can expect from us. Our goal in this office is to offer the highest quality, gentle, specific upper cervical care to as many people in our community as possible. Highest quality is important to us because over 95% of our patients are referred to us by other satisfied patients. Upper cervical care may be a new concept to you, and so I want you to know right now that our doctors are maintaining the highest level of excellence by attending seminars and trainings on the latest advances in technology and clinical applications. Again, Upper Cervical Care is focused on communication, is focused on the cause of your problem, not merely just covering up symptoms with, say, like a medication or a supplement or a therapy. So at this point, I'd like you to understand something about symptoms and pain. Many times your symptoms and your pain are your best friend. May not make sense to you, but it usually is true. And what I mean by that is this, is that a lot of times your body will give you a pain or a symptom to tell you that there's something wrong inside your body. And understand this, by covering up that symptom or ignoring it, you'll never ever get to the cause. If it's a pinched nerve at the top part of your neck, then all the medications in the world will never unpinch that nerve. So relieving pressure on the brainstem is accomplished in our office by finding that bone out of alignment, specifically determining how that bone is shifted, why it's doing what it's doing, and then moving that bone and putting it back where it needs to be so that your brain can heal, function, and communicate the way you were designed. So today, our doctors will take you through a series of evaluations consisting of one, paraspinal digital infrared imaging. That technology allows us to measure the nerve system to see if it's working good or not. Then we'll take you through a series of neurospinal testing to see how well your body's working. And then finally we'll finish up with three-dimensional upper cervical x-rays. Just so you know, the top two bones in your spine can misalign 274 possible ways. So all these tests and x-rays are very important for allowing us to determine how to take care of you from this point. From these evaluations that we do today, it will allow us to determine if we can accept you for care. It'll give us information on how long the problem has been there, and then more importantly, roughly how long it's going to take us to get this area stabilized. If your problem is an upper cervical problem, I want you to understand right now, nothing is going to be more effective for you than Upper Cervical Care. I also want you to know if it's not an upper cervical problem, we will definitely find the right specialist for you for your situation. I would also like you to know that my staff is highly trained to help you. So at any point in the process that you have a concern or a question, please speak up and ask. I also want you to ask the question to a point in which you get an understandable answer. And I really do mean that. So again, thank you for choosing Upper Cervical Chiropractic of Georgia. It means a lot. So if you will, take the remote, turn off the TV, and one of our doctors will be in just a moment to help you. Thank you.